Hello, this is a small class on diagnosis of dental caries. What is dental caries? By definition, caries is a multifactorial transmissible infectious oral disease caused primarily by complex interaction of cariogenic oral flora with fermentable dietary carbohydrates on the tooth surface over time. There are several methods to detect initial caries, and there are an n number of recent advances that help in caries diagnosis. Now, the first uh, advancement is a zero radiography. And how does zero radiography work? Zero radiography works by a complex electrostatic process, and the basic principle by which this system works is photoconduction. The photoconductor used in zero radiography is amorphous selenium. The selenium is just deposited as a thin layer onto a sheet of aluminium to form a zero radiographic plate. Now what happens is there is production of visible image by utilizing a charged surface which is amorphous selenium here as the detecting medium, partially disrupting the charge by exposure to X-rays to form a latent image, and making the latent image visible by a zero radiographic processing. Now, the disadvantages also this system works by the process of edge enhancement, which means differentiating areas of different densities, especially at the margins or edges. Now, the disadvantages of this system includes the electric charge over the film causes some discomfort to the patient, the exposure time may vary, and the process of the development can be delayed and is to be completed within 15 minutes. Now, these are some of the limitations of zero radiography. The next system the next recent advances for caries diagnosis is a radiovisuography. Now, what is a radiovisuography? It is a modern method of making radiographs of teeth in which X-ray films are replaced by a digital sensor. X-ray pictures of the mouth or panoramic radiograph will be displayed immediately after the exposure on a computer screen. Now, the advantages of digital radiography include dark room may not be required, the quality of the image is consistent, super resolution, elimination of hazards of film development, radiation dose is decreased, and the capability for teletransmission. So these are some of the advantages of the digital radiography. Next is electrical resistance, or the system which works by electrical conductance and impedance. Now, the sound tooth is a good electrical insulator due to its high inorganic content. The electrical conductivity, however, is directly proportional to the amount of demineralization. So, these systems, okay, which is a caries meter, will utilize this principle. The advantages is that it is very effective in detecting early pit and fissure caries, but the disadvantages are it can only recognize demineralization and not caries specifically. Now then there is a system called fiber optic transillumination, and the principle of fiber optic transillumination is that the caries lesion has a lowered index of light transmission. So an area of caries will appear as a darkened shadow, that will follow the spread of the cavity through the dentin. The advantages of fiber optic transillumination are no hazards of radiation. Lesions which cannot be diagnosed radiographically can be diagnosed using fiber optic transillumination. The disadvantages are, however, permanent records are difficult to maintain and difficult to locate the probe in certain areas. Now, the next system is a digital imaging fiber optic transillumination, and was developed to reduce the shortcomings of fiber optic transillumination by combining fiber optic transillumination with a digital CCD camera. Now, the images captured by the camera are forwarded for computer analysis. Now, this system basically enables dentists to confirm the presence of decay that can't be seen radiographically. Now, the other advancement is a quantitative laser fluorescence. Now, this quantitative laser fluorescence relies on fluorescence, and fluorescent signal is observed when the teeth are exposed to blue light in the range of 488 to 514 nanometer. Now, basically, this causes the sound tooth structure to fluorescence, whereas the tooth structure, on the other hand, may also flourish, but the disruption of the regular structure of the tooth at this point results in profound scattering and no or little fluorescence is detected. The other system is a diagonodent, which is basically a variant of the QLF system. The light source is a specific arc lamp based on xenon technology. In the diagonodent, a diode laser with 655 nanometer wavelength is irradiated on the dental surface. It is absorbed by metabolites of intraoral bacteria, and these metabolites will emit a red fluorescence. Okay, so that's how you detect a caries using a diagonodent. There are several dyes also which are used for detection of caries. There are enamel caries dye, and there are specific dyes for detection of dentin caries. And the enamel caries dyes, however, are Procyon, Calcium, Zyglo, Brilliant Blue, and dentin caries dyes include 1% acid red, propylene glycol base, iodine. Now, dyes have been used for detection of caries, and basically this dye system or the usage of dyes will stain with infected dentin. Ultrasonic imaging have also been used for caries detection. Ultrasonic probe is used which sends longitudinal waves to the surface of the tooth. Sites with visible cavitation will produce echoes with substantially higher amplitude. Now, a combination of diagnostic tools are always used for diagnosing lesions earlier, and this will basically help in detecting caries faster so that the tooth can be put on a restoration cycle and uh, treated successfully before the caries progress. Thank you. ஜன்னி இது என்னோட இதில் பென்ட்ரைவில் இருக்குது. இது உங்கள் சிஸ்டம்க்கு எப்படி எடுத்துகிட்டு போகிறது? இது எக்ஸ்போர்ட் பண்ணணும். அது போட்டுருக்கு. நீங்கள் ஒரு தடவை பார்த்துக்கோங்க இருக்காங்க. ம் 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 வருதா? அதுக்கு ஏதோ பேசிட்டு தேங்க்ஸ் ஃபார் திஸ்